Good morning. Good morning. Delegate Rodney Willett, your chairman. It's great to have everyone with us. We're going to call the roll, and then we'll get into the agenda for the day. Thank you. Excellent.
Oh, I didn't put it up on the board. So
Okay.
I don't see it doing anything.
I think we do have a quorum, so we're good. No, again, welcome everyone. It's great to have you with us this morning. We are actually not hearing bills today. There's a little confusion on the posting. There'll be bills heard after this meeting at the Health Subcommittee meeting. But we are fortunate today to have two presentations from some of the new members of the Spanberger administration. So really excited about that. I did want to call everyone's attention to those subcommittees, which will kick into gear shortly, and just to note our stellar group of chairs who we have. We'll have Delegate Patrick Hope kicking things off with health today, and it's great to have Patrick back there. Sia Price again with health professions. Kathy Tran, who will be here shortly, our vice chair for social services, and then taking my place on behavioral health, Delegate Deborah Gardner. Really excited to have her in that role. So stay tuned. You'll check the schedules. We'll meet throughout the week and then going forward. And as things go here, we will ramp up very quickly because we do have quite a number of bills to look at, starting with health today. So excited about that. But first things first, really excited to have our new secretary here, our new secretary of HHR. He is a familiar face to most of us here. Marvin Figueroa has served previously in the Northam administration and then gone on to, did we say bigger and better things, or are this other things at the federal level? Better things here. Okay, better here. But it's just such a great thing for the Commonwealth to have him back in Virginia. So we thought we'd have him just share a few words. He's got quite a job and very significant agencies that he is overseeing, and we've been meeting, and again, I just couldn't be more thrilled to have him here. So, Mr. Secretary.
Good morning, everyone. Mr. Chairman, Vice Chair, and members of the committee, thank you for the opportunity to be here today. My name is Marvin Figueroa, and I'm honored to serve as Virginia's Secretary of Health and Human Resources in the Governor Spanberger's administration. I want to begin today by talking about my why. I am a proud Virginian, though I wasn't born here. I was born in the Deep South, Honduras. And I came to this country, took a while, but I got there. I came to this country at 4 years old. I grew up in the Bronx, raised by a single mother who was a school teacher, but left her profession to build a more stable life here in America. She became a home health aide and then a lunch lady, caring for others even when it meant putting her own needs last. Like many families, we depended on public schools, on public health, and a patchwork of safety net programs that needed to show up when we needed it the most. And when they worked, we had a chance. With support from Pell Grants and scholarships, I attended Vanderbilt University and later Harvard. My career brought me to Virginia as a staffer for Senator Mark Warner, where I learned early about bipartisanship, practical policymaking, and the need to put points on the board. I worked on legislation to improve services for individuals with multiple chronic conditions by removing outdated and strengthening coordination across payers. In 2018, I came to Richmond to serve in Governor Northam's administration as Deputy Secretary of Health and Human Resources, with a focus on behavioral health, social services, and of course, Medicaid. We worked on Medicaid expansion and building more complete behavioral health continuum. That work required true cross-agency collaboration, as well as close coordination with private industry and a broad range of stakeholders to improve care delivery and remove barriers to access to care. Those roles took me across the Commonwealth. I spent time in Northern Virginia and Henrico visiting community health clinics serving rapidly growing populations. I visited rural hospitals in Pulaski and Emporia where providers were delivering care with remarkable creativity despite limited resources. I traveled to Southampton and Lee County where families told me how maternity ward closures were forcing them to drive hours, sometimes across state lines, just to deliver a baby. I worked on Medicaid enrollment and heard directly from people who were grateful to finally have access to care after being rejected so often, so many times by everyone. I also visited Shenandoah Valley and the Eastern Shore, where the challenges look different, but the needs are just as urgent. I carried those lessons with me to the U.S. Department of Health and Human Services and later into private sector, which gave me a clearer view of how public decisions shape markets, affecting innovation, partnerships, and quality. Those experiences did not just shape my understanding of health and human services, they reinforce a core truth. Good policy only matters if it's implemented well, and systems only matter if they deliver for the people who depend on them in a sustainable way, both programmatically and fiscally. I believe in getting the fundamentals right. I believe in working across ideological spectrums, and my upbringing has taught me that you can find common ground with almost anyone, and that you have to recognize that government cannot solve everything, but it can be a force for good. I returned to Richmond because I love this work. I believe in Virginia, and I believe in Governor Spanberger's clear and practical vision for government that is more responsive, aligned with what people need for economic mobility, and focused on delivering real results. As we begin this administration, our priorities are straightforward. First, we will protect the core functions of our health and human services system, with an eye towards scaling what works and reforming what no longer serves its purpose. Second, we will ensure stability and affordability at a time of significant federal and budgetary shifts. H.R. 1 will have real impacts in the Commonwealth. We need to be clear-eyed about those impacts, mitigate harm where we can, and responsibly leverage opportunities where they exist. And third, we will make sure our programs work the way they are intended, effectively, efficiently, and with accountability to families and taxpayers. For me, this work is personal. It is about families who do not have the luxury of navigating complicated systems, families who need government to be reliable and clear, families who want a fair shot, families like the one I grew up around, one of the families that I come from. And it's about taxpayers who invest in the system and want confidence that their hard-earned money is being used wisely. I look forward to working closely with this committee and building a strong, transparent, bipartisan partnership in the years ahead. Mr. Chairman, thank you for the opportunity to be here with you all today.
Now, Mr. Secretary, thank you so much, and I know we really look forward to working with you, working with your team as we move forward. We do have some daunting challenges in front of us, and we've started to talk about those, and appreciate some members of your team coming here previously for our first meeting to dive into that. I know we'll have other presentations, then, of course, working with you on the legislation, budget, et cetera. But again, it's great to have you here. Thank you for all you've done. Thanks for coming back to Richmond. Appreciate it.
And Mr. Chairman, if you will allow, I would love to introduce my team.
Oh, please, please. Yes.
We have Tony Blue, Deputy Secretary. We have Lauren Walker, Deputy Secretary. We have Rashana Senior, who is my Chief of Staff. And we have Lucy Schwartz, who is Senior Advisor to the Secretary. Mr. Chairman, thank you.
Thank you. That's great. What's that? We forgot the grilling part. Going for a chair.
Thank you, Mr. Chairman, again.
We want to lure him in. Say, oh, this is the nice committee. It's the nice guy. But we want him to come back and do that. The nice committee, that is us. In 2019, my middle son, Winston, was being graduated from the University of Virginia. It was a beautiful day, big crowd there on the lawn, and I did what every parent does. I got there early because you got to get a seat. It's a big graduation. But I got the program, and the first thing I do, of course, who's speaking to us? So I opened the program up, and there was a UVA doctor on the program named Cameron Webb as our speaker. So I read got to read the bio, because I did not know Dr. Webb. So I read this bio. I see his public health background, public policy background, equity and medicine background, law background, work in Washington background. I'm going, this guy's got to be at least 70 years old because of all he's done and accomplished. And then he comes up, and I wasn't sitting right down front, but I could see well enough to say, this gentleman is not 70 years old, not by any means. In fact, he could have passed it. He could have been getting a diploma that day as an undergraduate, for all I knew. He was very, very young in appearance, but very, very experienced in all he's done. So when I learned from the Spanberg administration he was going to be joining as the Commissioner of Health, I was absolutely thrilled. We'd had a chance to work together on the transition for the Spanberger administration. He was one of the leaders there already and then stepped into to this role. And he knows he's stepping into a big role. This is one of the most important jobs in the Commonwealth. He keeps us all safe, keeps our families safe, and never has there been a more important time to have someone of his caliber coming into that role and to take care of us. So Dr. Webb, Commissioner Webb, it's great to have you here.
Thank you so much, Mr. Chairman, Vice Chairs, and members. It's really my pleasure, my honor to be here before you today. And primarily to give you a little bit of an introduction to who I am, what I stand for, and what animates me in this work. I always start by saying I'm a kid from Spotsylvania, Virginia. It's a big part of who I am. And I heard the little hushed whoop. That's great. But beyond being from Spotsylvania, there are two dynamics I think are really critical in my story. The first is that both of my parents were committed to service. My mom was a teacher in Orange County at Locust Grove Elementary and at Prospect Heights Middle. And my father was an administrator for the DEA. So initially worked in Crystal City and then eventually at Quantico. And for both of my parents, they really infused into their 6 children, and yes, I said 6, the importance of service and of showing up and being there for people. Now, when I describe being the third of 6 kids, that's also really important in my story because it's a relatively large family by today's standards. And being the third of 6 kids, you get a lot of particular things. You get a lot of hand-me-down clothes. You get a lot of teachers who say, aren't you so-and-so's little brother? But you also get a lot of visits to doctor's appointments. And I always tell this story that there was a young black physician in Fairfax, Virginia at the time. His name is Dr. Timothy Yarborough. And he was my doctor growing up. And they always say you can't be what you don't see. So for me, seeing that black man in a white coat serving our community was powerful for me. It created for me the interest in serving my community in that particular way. And so at 5 years old, that's what started my passion for serving my community through health. You know, over the years growing up in Spotsylvania County, I saw communities, I saw portions of our community, groups of people who didn't have the kind of access to care, the kind of supports and services that they needed. And it only further emboldened my passion for service, ultimately leading me to the University of Virginia, where I, yes, completed that pre-med track, but I also focused on broader issues of health and well-being across the population. I finished up college at the University of Virginia and went on to medical school at Wake Forest University in North Carolina, and also law school concurrently. And it's not to protect myself from being sued, even though that's what most people think. In fact, it was because I'm so motivated by this idea that health justice is the core of what we need in our communities, that idea that everyone should have the opportunity to be healthy. I want to emphasize that idea of opportunity, right? In our communities, there are so many factors, so many realities that make it challenging for people to be healthy, to get healthy, or to stay healthy. And so much of the work of the agency that I'm honored to be stepping into is about those 3 very ideas, those ideas that, you know, it's about where you are born, grow, live, learn, eat, play, and pray. And those factors shape in so many ways the reality of health in this Commonwealth and in this country. And so, you know, as I moved forward, I completed medical school and law school. I went off to my residency training. I worked as a community health worker in New York City for some time. I did community organizing in Indiana, but all roads led back to home, which ultimately brought me back to Virginia. I'm passionate about this Commonwealth, and I'm passionate about its people. Along the way, I took a stop in the White House. I worked at the end of the Obama administration on the implementation and rollout of the Affordable Care Act, but also more broadly on the White House healthcare team. I learned a lot about how government can serve people through its programs. Uniquely, I actually stayed in the White House to work in the first Trump administration. And I helped to lead on reducing the cost of prescription drugs in those first months of the new Trump administration. Then coming back to the University of Virginia, where I became a professor in public health sciences, really focused in on how we could leverage the resources and tools of a large academic institution to meet those needs of the population. Did research through my Health Equity Law and Policy Research Lab. If you're tracking, that acronym is HELPER, right? To figure out how we can use research as tools to help our communities. A few years later, I was called back to public service. At the beginning of the Biden administration, I was asked to come in and serve as a senior advisor to the president on the COVID-19 response. And though initially the focus of my role was on this idea of equity, really what the team said was it was that idea that everybody across the country should have access to the resources and tools to successfully navigate what was the greatest public health crisis of our time. And in that work, I got to help ensure access to vaccines, to personal protective equipment, to treatments, and to tests. Raise your hand if you got a test through covidtest.gov, if you went on that website and accessed those tests. I was a part of a small 4-person team who conceived that idea and made sure that that can get out to all of our communities. Really realizing that public health is a trust. It's about how we show up in communities. It's about how we listen to the needs and concerns of the people and how we rise to the occasion to meet those needs. And I'm excited now, just a couple years later, a couple more gray hairs than Delegate Willett mentioned at the time of my graduation speech, but coming back into this role to really focus in on meeting those needs. The Virginia Department of Health is a large and broad organization, and it has a large and broad mandate. It's an organization where they've worked tirelessly to improve the operations in recent years in response to the JLARC report, in response to some of the public blemishes to the name, because they want to stay true to serving and meeting the needs of the people. I'm excited to step into the role at a time where so much energy has been spent on strengthening the operations so that we can run full speed in meeting the needs of the people in the years to come. And so with that, I do yield back my time. I'm excited to work with you, to meet with you, to learn from you, and to listen to you, and all the folks that you represent. Thank you for your time today, and look forward to the relationship.
Thank you. Dr. Webb, Commissioner Webb, thank you so much. It really is wonderful to have you part of the team and on your career track to have come back to Richmond. That's wonderful. I would argue Washington does need a lot of your help, but we need you too. So I'm glad to have you. And I really take to heart your comments, particularly on the one theme, trust in public health. I think there are some issues with that coming out of Washington, and a lot of people are doubtful of what they're hearing, and that uncertainty is not where we want to be, particularly in folks trying to make decisions about vaccinations or whatever, just what to eat. Uncertainty there. And I think you're going to be a great voice for a healthy life and doing the right things from a healthcare perspective. And you do, as we discussed briefly before you came up, folks will learn the breadth and depth of what VDH does. It is an incredibly expansive agency, and we see certain parts of it, but then there are another 20 to go along with that. So it's a big job to lead that. But I think we're here to work with you and definitely make progress. There's going to be a lot of bills affecting what VDH does, so we'll get those done. But again, thank you, Mr. Secretary. Thank you as well for being with us. I will pause for a minute. Any questions or anything I can answer from the committee? Thank you. I think, as I mentioned, we had a couple folks join late. We were really excited, and my vice chair is here. He's going to take care of us as well in her dual role of leading social services. And we'll kick those subcommittee meetings into gear, including health, which will convene immediately following this meeting. With that, we are adjourned. Thank you.